Are recurring gut symptoms leaving you confused about whether you have SIBO, small intestinal bacterial overgrowth, or Candida? Well, here's the truth. Relying on symptoms to differentiate between these two conditions is unproductive and only drags out addressing your gut dysfunction. Instead, let's look at how the most fundamental diagnosis concept, a good history, can tell you exactly which one of these you're dealing with. Like every other doctor going through school, we all learn the value of taking a good history. However, sometimes we can get reliant on trying to match symptoms to a condition or expecting the latest test to give us the answer. Well, today, I'm going to illustrate how the use of the history and nothing else can tell you if you're dealing with SIBO or Candida. But before we get started, let me introduce myself. I'm Dr. Arland Hill, and I help first-time and recurrent SIBO sufferers restore their gut function by targeting all three phases of the condition to resolve symptoms in a timely manner. Let me start us off today by illustrating how symptoms can get us in the ballpark of where to look, but not give us a clear vision of the problem we're dealing with. Let me start off with SIBO symptoms: abdominal pain, gas, bloating, diarrhea, irregular bowel movements. What about Candida symptoms? Abdominal pain, gas, bloating, diarrhea, maybe chest pains, belching, indigestion. Well, as you will note, there's a lot more overlap between those two lists of symptoms than there are differences. There's only minimal or minor differences there. And these differences aren't enough to directly point to one condition over the other. So we need other ways of being able to differentiate. Now, before I take you in that direction, I want to acknowledge something here, and that is the historical difference between SIBO and Candida in terms of its popularity of diagnosis. Prior to the existence of the knowledge of SIBO being a more common topic in healthcare, probably within the last 10 to 15 years, most notably, this would have been labeled as Candida if you had this grouping of symptoms. Again, if you showed up with abdominal pain, gas, bloating, diarrhea, you'd have probably been told that you had Candida. And there would have been the use of what's known as an IgG or an IG test, an immunoglobulin test, to validate that. There was no focus on SIBO. But that's not the case now. We see that generally there's a lot more discussion about SIBO than there is Candida. And the testing also begins to be a problem because there's a lot of limitations when it comes to testing for Candida. And keep in mind, as I'm talking about Candida, we can talk about Candida as in the small intestine as SIFO. So when you hear that name, that's small intestinal fungal overgrowth. And testing on this has its own limitations. You actually have to culture the intestinal juices, so you have to collect those intestinal juices, you have to culture them out, and you have to see if there's growth of Candida there, and even then it has to be above a certain level. You could use antibody testing or even stool testing, but these aren't going to directly point to a Candida overgrowth in the small intestine. Certainly, it's just going to be a possible assumption based on the finding on that test and the linkage of the symptoms. So can you see how chasing symptoms and relying on testing is not going to give you results here? It's just there's no clear avenue of which one you're actually dealing with. So now let's talk about what we can do. And so to begin with, I want to speak about Candida. And keep in mind that Candida is actually quite a bit different than it's normally portrayed. It's normal to find Candida in your intestine, in the oral cavity, and also in the vaginal cavity. A lot of times we don't think about it as being a natural component in these areas, especially not in the intestines and the oral cavity, but it's naturally found there. And there's generally three varieties of Candida we can think about. One I introduced to you prior, small intestinal fungal overgrowth. The second of these is going to be when that overgrowth is in the large intestine, and the third is going to be when it's systemic. And it's this latter, this systemic, that can be a clue for us. Now, Candida albicans, which is the Candida that you often hear the most about, it's not the only one by any means, but it's definitely the one you hear the most about because it is prolific. But It's generally labeled as a commensal fungus. So that means, again, that it's inherent to find that in our gastrointestinal tract. Finding it is not abnormal. Finding it in excess is. But it's when Candida becomes aggressive, it transforms into this virulent state, into what's called its hyphal form. That's when it gets aggressive and virulent. And this hyphal form that I'm referring to, you can think about this as when it's vegetative, when it's growing, if you will. Candida is often going to present as a concurrent overgrowth, so it's not typically acting in isolation. There's generally other issues going on with it. There's other dysfunction that's occurring with Candida. So for example, we often see that there's a reduction in immunity. And the problem with that is that when you have that reduction in immunity, it prevents the natural immune cells that would normally go and target Candida from working efficiently. So that's one problem. A second problem is that the inability or the deterrence from allowing Candida to adhere to cells in the body, that's reduced. And the inherent ability to kill Candida off goes away. It's just minimized. I shouldn't say it goes away, it's minimized, depending on what your level of immune system dysfunction is. And when you look at this, the problems here are, again, that we can have Candida in different places. So as you can see already, Candida is occurring secondary to something else. And it's when the immune system doesn't operate at its highest level of efficiency, that's when we need to start having concerns here. And so with Candida, we can see that there's going to be differences in the mouth and the stomach, small and large intestines. So you can see it's throughout the entire GI tract. You can even have what are known as nosocomial infections. And these are ones that they can end up in the bloodstream. These are extremely serious. These are byproducts of being in the hospital. And part of the reason that Candida can be so tough is because it forms biofilms. These are protective coatings that Candida, as well as other organisms, can do this, but these biofilms are protective. And that protective coating around them, in addition to a scenario where you have a weakened immunity, those biofilms, those protective coatings, they inhibit the natural defense mechanisms against Candida. So our immune systems naturally have defensive ways. There's multiple ways that this occurs in your intestines. You can have mechanical ways through normal motility in the bowels. You can have chemical ways through the secretions in the stomach and small intestine. You can have microbial, I call this microbial warfare, but it's basically a microbial obstacle where your beneficial organisms inhibit the growth of Candida, and your inherent immune system can start to inhibit the growth and activity of Candida. So there's natural ways, there's multiple defense mechanisms, but these all get, when you see Candida present, these aren't functioning at a high level. These aren't functioning optimally. So the real decision making here is the history. If you're trying to differentiate between SIBO and Candida, you need to know the history. If you have an immune challenge situation, for example, I'm going to give you some more overt immune challenges here, but let's say someone who is HIV positive, someone who's been on steroid use. So like the corticosteroids, where they are used for suppression of inflammation, but they also suppress the immune system. Someone who's been on antibiotic therapy, cancer patients, individuals that have poorly managed diabetes. They all have a higher risk. They're all immune challenged, but they all are going to have a higher predisposition for Candida. So that history for them would point you more in the direction of a Candida issue versus a SIBO issue. Now, it's also stated that SIFO affects healthy and immunocompetent individuals and can create GI issues with them as well. But here's what I would argue to that, in that when this is stated in a lot of studies, they're not actually defining healthy and immunocompetent. And so it's very feasible that many of these individuals, since these things that I'm getting ready to acknowledge are so prevalent in the population as a whole, They could be dealing with things like nutrient deficiencies, reductions in the diversity of species and the balance of species in their gut. They could have hormonal issue. They could have heightened ongoing stress responses. These are all things that are going to reduce the efficiency of the immune system and open the door for Candida. You can also see Candida become more of a scenario for individuals that have structural changes to their intestines. There's a greater prevalence of Candida and SIBO in these individuals, and it's secondary to the changes in the digestive secretions. You see all the time that it takes things to move through the GI tract. Those are going to change. There's changes to the overall musculature in the gastrointestinal tract because of these procedures. And so these structural changes are going to open the door for Candida as well. It doesn't mean that there's not possibly SIBO in these conditions as well. There could be, but you just this history increases the likelihood that we're dealing with Candida instead of SIBO. Now, medications. These are all things that would be part of the history. If you're trying to differentiate between these two and you're checking some of these boxes on these things that I'm listing for you here, then you can start pointing yourself more in the direction of Candida. Medication. PPIs, your proton pump inhibitors. These are known to be associated with SIBO, but they can also be associated with SIBO as well, or Candida, because they lower the acid in the stomach, they slow down the motility in the bowels, and those are just going to predispose to some type of overgrowth because you're minimizing the clearance and the secretions that inhibit the growth of these organisms. Antibiotics, they weaken that microbial obstacle that I mentioned earlier that tends to deter Candida. And then interestingly enough, also antifungals. So things like some of these names, I'll share these because some of you might recognize these names. Ketoconazole, fluconazole, diflucan is the other name for that. These are going to be some of the major treatments for Candida that have been out there for nearly 2 decades now. But what we're starting to see is that there's resistance that's developing to these pharmaceuticals, to these antifungals, and that declining susceptibility is an expanding problem. So as that declining susceptibility continues to expand, it increases the probability that you're dealing with Candida. And so if you've been treated with Candida, or treated for Candida, if you've been treated for Candida and you still have it with these antifungals, that could be another clue that, you are indeed dealing with Candida. Don't necessarily take your eye off the ball. It may just be that these antifungals aren't working the way that they're supposed to. Or if you had SIBO and you were treated for it, especially if you were treated for it with antibiotics, but you're still symptomatic, well, now the issue might be that you're dealing with the SIBO and the SIBO wasn't remedied. So that could be another trigger too. So just look at what your experience has been through your treatment process, and that'll start to answer some questions for you as well. So knowing your history is really going to help you out. And again, I do want to just make sure that I mention this. There can be about a 30% overlap between SIBO and SIBO. So it is feasible that you could have these at the same time. So coming off of that comment that if you've been treated for SIBO, but you're still symptomatic, well, it's probable that in 30% of individuals, you're still dealing with SIBO. So don't overlook that point. So knowing your history is going to really help you refine your treatment, and it's going to, especially if you're immunocompromised, it's going to point you more in a direction towards Candida. So you need to know what your underlying causes are, because that's going to lead you to a more efficient treatment beyond just dealing with antifungals. Because remember, when it comes to Candida, it's the weakening of the immune system. So if you only go in there with antifungals, you're going to miss the mark on that. You may temporarily see improvement, but you're not going to see long-term improvement there. So secondarily to those antifungals, you need to be focused on building the immune system. We want to enhance the beneficial, or what are called commensal organisms in the gastrointestinal tract. You want to couple that with a powerful antimicrobial strategy and that antimicrobial can be antibacterials and antifungals at the same time. And if you need support on what to do with that, how to work through that, take a look in the description at the SIBO Solution. That's an option for you that can equally work for SIFO as well. So if you're serious about getting to the bottom of your gut symptoms, dig deep into your history and honestly assess your immune system. Is that a part of your overall health needs right now? But before you go all in on Candida or on SIBO, there's one more condition that you need to know about that is also a part of this conversation. It's called IMO. IMO, and you can learn about how it compares to SIBO in the video on the screen right now.